we understand that the body has a sewer system to it that you're not taught about. This is suppressed or not brought up and not understood by the allopathy. And therefore, this sewer system is how the sewage from the cells, you know, and you can talk about the two avenues of elimination. You have two types of elimination, obviously. You have urine and you have stool. Well, what's the difference between the two, and which elimination factors are they involved in? Well, it's obvious the stool, undigested matter, things not absorbed, obviously, all the stuff that goes down the pike. It's a big tube, right? And so you have that, but then what about the urine? What is the urine? Just excess water and a few chemical byproducts and stuff? Heck no. It is a major sewer system. It is, notice you have two kidneys, and then you have a skin, the largest organ you have. So, and I'll say the largest eliminative organ you have. So, real important to understand that you have cellular waste to get rid of. And I think it's easy to explain to people that every cell is like a person. Every little cell requires food and eliminates waste. And you can look at this like if you're a cell in someone's liver, you just can't get up and go to the bathroom when you have to go, right? A cell has to go to the bathroom. And a little cell, it gets hungry. It's got to eat. And so how does the cell eat? And then how does the cell eliminate its waste? Does the cell just get up and go to the bloodstream and lick out what it needs? No, it's serviced on site. That's where we get interstitial fluids that flow around the cells. Important, and that's all that's there are the fluids that flow around the cells, which is blood and lymph, and the cells themselves. That's it. Remember, the lymph system is that one magic fluid that most people just know it as the lymph system. When they get stiff and sore, they look for a massage therapist. When they get pain, they look for an acupuncturist or a chiropractor. In other words, you're looking for a remedy from lymphatic problems. And the problem is that all these forms of therapeutic modalities are terrific. Unbelievable what I've seen chiropractics do. Massage therapists, a good one, can really open up some doors. Some good acupuncturists. But the reality is that someday you've got to go in and remove the obstruction, the acids that are causing the pain, that are causing the lymph, that's causing the stiffness and the tightness and the pulling on the spine. We've got to go in and deal with that system. It's been a system that's been ignored. I can't understand why. It's obviously the predominant system of the body, immune/sewer system. So always know that when you have lymphatic problems, you have it from head to toe. Just because you're unaware of it, a lot of people can be backed up lymphatically and not have arthritis yet. And that's when you start to notice those pains in the joints and things. This becomes a chronic issue because this has been years in the making. So it takes a little while to unwind that. I think what's neat is that we can unwind this so much faster than we created it. Thank you, God. Because imagine having to take 20, 30, 40 years to unwind to a point where you're free of pain and stuff. That'd be a nightmare. So when your lymph system is backed up, and this lymph system is the body sewer system, the main immune system of the human body. When this system's backed up, what is it backing up? It's backing up cellular waste, which are acids. And when these acids back up, after a while, in a chronic way, absolutely, you don't feel them at first except for some stiffness and some tightness, some joint pain here, that. After a while, it becomes more systemic. Why? Because this is a systemic fluid. When the lymph system backs up in the prostate, for an example, and causes you a little prostatitis, or it backs up the ovaries and causes ovarian cysts, it's already backing up in your head.